Bumi. Thank you so much for your time so far spent here with us at the TCN Learning Summit. We're sure you've had an amazing time. I'm about to introduce the next speaker for the last session for today. Her name is Eyitayo Iyotim. Eyitayo Iyotim will be taking us on how to manage mental health in the workplace and why it is so important. So I'll just read through her profile for a minute and then we'll just let her in. She's already in, she's on standby, she's ready to go. Eyitayo is an organizational psychologist, human resources management specialist, and ICT project manager with over 20 years experience in project management, training solutions, software sales and operations, organizational development and talent management solutions. She has worked with many individuals and teams, coaching and mentoring the teams for success. She is a CEB SHL certified. She is CEB SHL certified in ability and personality testing, and also certified in project management and life coaching. She is a member of the Life Coaches Association of Nigeria and the British Psychological Society. She also has an MSc in organizational psychology from the University of Manchester, UK. Eyitayo currently serves as Chief Operating Officer at Nigeria Internet Registration Association and as the CEO of Whetstone Coaching and Talent Urbanity Limited. She is a proud mother of 3 lovely sons. One of the things I like about the topic that Mrs. Eyitayo Iyotim is going to be taking today, which is how to manage mental health in the workplace, is just how much we don't take mental health seriously in this climate. I mean, we're just the people that we don't take this very seriously. I mean, Bolaji has come in, Amaka Akitaye came, and everybody has told us all what we need to do as HR professionals. And this is great. Managing all of this with the burden of managing the entire organizational workforce as well can be a thing. A lot of times we ask ourselves, who takes care of HR? But beyond taking care of HR, we also have to look out for the mental health of the entire organization as well as ours. So Ms. Eyitayo Iyotim is going to shed some light on that today. So please just let's welcome her in. Good afternoon, Eyitayo. Good evening, Eyitayo. Are you in? Can you hear me?
Yes, I am. I can hear you, Bumi.
I can see you very much. I can see you very well. Welcome.
Thank you.
So the floor is yours.
Thank you very much. Good evening, everyone. And I'm happy to be here. Good evening to TCN, the TCN family. I'm excited. I'm honored. Good evening, Pastor Poju, and the entire team that put this together. I've learned a lot this evening and I'm truly excited. So let's get right into it. I understand that we are running behind time. Well, you already know my name now. Eyitayo, yes. So I want to talk about how to manage mental health in the workplace and why it is important. And it's interesting that Bumi has already mentioned we're not doing enough about mental health in the workplace in Nigeria. Of course, the reason is because we're focused on a lot of other mundane things that should already be sorted but are not. Anyhow, we need to still have these conversations, and it is key now, post-COVID, more than ever. So I'll start with a few basics. So we need to understand what mental health is. So many people think mental health is the same as mental illness. No, no, no. So mental health is the way that you think, you see, and you behave. See in terms of perceive. So mental health is your entire, what is behind your mind? What is in your mind? What are you working with as you're taking decisions? So, I mean, we've talked about decision making, we talked about data, we've talked about a lot. But mental health drives your capacity to take advantage of all the data, all the people, whatever policies you want to put in place. If you're not mentally healthy, then you cannot work, you cannot be productive. It has a huge impact on our ability to cope just day to day, just to cope with living from day to day basic things. And if our mental health is poor, which is either we have mental disorders or we're mentally ill, then there's an impact on everything. Actually, a lot of physical illnesses have psychosomatic roots, which means that your mind controls the body a lot of times. Now, considering that people spend quite a bit of time in the workplace, it's important for the workplace to be a place of stability for the people as well. I mean, the workforce, every organization, the workforce is the asset, the pearl of the organization. Without the workforce, the organization cannot achieve their goals, no matter how lofty those goals are. I just want to cite a 2019 study by the WHO, which stated that the world was losing, the global economy is losing about $1 trillion annually. This was 2019, so they were talking about 2018. I don't know what the numbers will be like in 2021. So we're talking about a real situation and a real problem. Now let's talk about our society. So we all practice, we work here in Nigeria. Well, most of us, Toby, thank you for coming in, but most of us online work in Nigeria. So what are the peculiarities of our society? Why is it so difficult to have a conversation about mental health? And just when Bumi was speaking, I decided I should add stigma to that list. So there's an imaginary word there, stigma, note. So the first thing is that there's scarce credible data on mental health. So I called a friend of mine, a former classmate who's now lecturing and is a professor. I asked her, what is the current statistics? How many people, 1 in 4, 1 in 6, what is our projection about mental health disorders in Nigeria? And she said, there's none. There isn't even an estimate existing that is published based on how people come to hospital or how people report or how people seek for help. And we don't yet focus on mental health as a reason for us to seek help. So that in itself is a problem, because if I don't know how many people need to be treated, then I cannot make so much noise about a factor that is so important in the workplace. Now, look at the other pressures around us. Poverty. So a lot of the vices in society are being driven by poverty. And I'm not talking about economic poverty alone. I'm also talking about mental poverty. There is a huge divide between how an average adult ought to articulate and how the people around us are articulating. That's a major problem. This is part of the problem that's leading to substance abuse, but we also have unemployment. We have all the other vices, greed, corruption in the society. We have adversities, power, water, transportation. So there's already quite a lot of stress that people are facing in our peculiar society. And this can be, quite a bit. It's a whole deluge for the individual. And the individual deals with this every day. Whether they go to work or not, they will deal with these peculiarities. We've also found in our society, and it's something that we're finding now, that PTSD, post-traumatic stress disorders, are increasing. People didn't used to speak about their trauma. People will get raped and then talk about it 10 years later because the platform upon which to speak, the infrastructure around which to seek redress just didn't exist. It wasn't pushed. So people couldn't work and people couldn't bring these things out. So all these factors are already in our society and they're here, they're peculiar. Now let's look at existing workplace factors, because the person is dealing with both existing factors in the society and existing workplace factors. So let's look at health and safety policies. Many organizations, particularly in the SME world, get away with murder, literally. There are no health and safety policies. When I say inadequate, I am cutting it. I'm just, being political with my language. Many SMEs have none. If something were to happen in the office, people don't even do fire drills. I mean, that's small. There's no escape. There's no emergency escape. There's no, the basics. They don't exist. Communication. There's poor vertical communication. So managers just come and say what they want to do and walk away. There's poor horizontal communication within the teams. Relationships at work are impaired. Participation in decision-making is limited. People are not able to participate. You see, when you participate, you're able to take ownership. So these are real factors in organizations. And I support quite a number of organizations. These are factors that we see. Low control over one's area of work. There's some organizations that insist on 10 people staying in a space that should have 5. So we still are not taking HSE seriously. We're not taking ergonomics seriously. The seats that people are sitting on, are they comfortable? Their tables, are they comfortable? The level of their laptops, on the, are these factors, are we considering them? Support. There's practically most organizations, there's very little support for employees who have a challenge outside of work, outside of the workplace. But these challenges come to the workplace. They come with these challenges. You see, it's in their mind. So as he's responding to you, he's still remembering, or she's remembering, what has happened last night, what happened 2 days ago, the fact that rent is not yet complete, and so on. Inflexible working hours, even in the middle of a pandemic, employers were still insisting that employees who don't have their own personal cars find their way to the office, risking the lives of the other employees. So these are just a few of the factors that we find existing in the Nigerian workplace. I just want to touch on COVID-19 factors a little bit. Stigma. A lot of people have no idea how they will cope mentally if they were to become COVID positive. It's not even the illness, it's just the thoughts of the stigma. Fear of dying, fear of death, not being ready, what's happening to my kids, insecurity. People don't know if they're going to have jobs at the end of COVID-19. I don't need to tell you, I mean, you're all HR practitioners, so you know that job loss is a reality post-COVID. There's also the lack of social support because people can't go out and see their friends. So the conversations they would have had before, which would reduce their stress levels, they're not able to have those conversations at the moment. People are feeling isolated because they're having to work at home. So people are also, domestic violence on the increase because the person who was already susceptible to being violent is now caged. They cannot go out. So there's no outlet for not necessarily a violent outlet. I'm just saying that sometimes, you see, when the brain has found other things to do, it's able to alternate its feelings and manage its emotions better. So people, for example, find that if at work they are really revered and, they don't treat people well, but people anyway revere them, that kind of, builds the ego. And when they come home, there's not that much demand on them being, Lord Almighty and being able to ride roughshod over everybody else's feelings and all that. Then there's the long haul effect. We found now that people who have already recovered from COVID-19, there is a group that has the long haul effect of COVID-19, which means that they've recovered, but some of them have anosmia, I think that's what it's called. Their sense of smell doesn't come back. For some people, the weakness, the fatigue, it doesn't go. For some people, they now have mental health disorders. So this is real. Then there's also the unpredictability of the illness. We have never seen COVID-19 before. So let's talk about what is likely to happen as we go post-COVID. We keep using the phrase post-COVID. I don't know when we'll be post-COVID. I don't know when it started, when it's going to end. But I think we started post-COVID from the first day that the first lockdown in any society starts. That's, the reality begins to dawn on us. So we have anxiety, depression. These are from the data that has been gathered globally, mostly from the WHO. These are the factors that have been, the trends that have been noticed. Anxiety, depression, burnout. People are just tired. Trauma and post-traumatic stress disorder. Remember that these people who are dying, those numbers that you see every day, that NCDC is quoting, those are real numbers, real human beings who have relations, who work. So people have lost their friends, they've lost their family members. This is real. And so post-COVID requires just a different approach. It's not going to be business as usual. So what can be done to manage mental health? And I'm going to talk very much about these factors now. In many organizations, and just 2 weeks ago or so, I was discussing with an organization about an employee assistance program. In many organizations, the true cost of an employee not being able to perform is not juxtaposed alongside the cost of having an in-house employee assistance program for the employee. If we do a true cost-benefit ratio, you will find that for many organizations, having an in-house EAP and an employee assistance program is real. It is all-encompassing. So there's counseling, there's reviews, and I'll talk a bit about it in a moment. So if you have an EAP in place, then you are preempting situations because people can walk into the counselor's office and say, look, I had a quarrel with my husband today, or my child needs to go to school and I don't have enough money, or my rent is due, my landlord has been on my case, I can't even pick my call any longer. These are real factors. These are things that are affecting people outside, and they have to deal with those factors. This is real, people. So engaging employees at all levels, many times in Nigeria, and I think it started from our education and the way, so this is me, the psychologist speaking, the way that we were trained, it is, just learn it for the exam. It's not learn it, cram it for the exam. Not necessarily apply your learning to life. But the essence of education is to be able to cope with the problems and the challenges that we find in life. So already there are those strata in the organization that we don't seem to cross. We don't seem to, it's so difficult to have a conversation from, whether you're coming from down and going up, or whether you're coming from up and going down. Many times there's not enough engagement. Employees are left behind. And when they're left behind, this can be a factor in their mental health. They are not even sure where the organization is going. Remember, I spoke about insecurity. So if they're not sure where the organization is going, then you can imagine how they will be at work. They are tense. They're under a lot of pressure. Leaders need to be vulnerable, particularly post-COVID. How are you communicating that you are under pressure as well? You see, they see you come in your AC vehicle, you have a driver, you don't even go through the traffic. I live in Lagos. The traffic that has been around the last few months has been really, really, horrid. And you sit at the back, you're probably on your phone or your iPad, and I have an official driver myself. So I'm speaking about those of us who are considered to be privileged. Yes, I know. You have worked hard to get to where you are, but it would be nice for the others to recognize that you have your stress at your level as well. It would be nice for them to recognize that when they don't do their work, it forms an angle, a stress angle for you. It also becomes a challenge for you. It increases your anxiety. You need to be able to communicate that you are also vulnerable. That's what I am trying to talk about. You have to communicate that you are also vulnerable. Don't live as if you are living in a bubble, because then you can't connect with the challenges that your employees are having. You have to model healthy behavior. So what are the relationships like at work? If you used to be that boss who comes in, or that HR manager who cannot be approached, and then at this time, you have to consider how your impact on the relationships at work. What's the impact? What's your impact on relationships at work? How are people coping? Are you being fair? Are you being just? These are the factors that can help to manage people's mental health. What about organizational culture? What has changed? A lot has changed. The work world has changed forever. And if it has, and your organization is still business as usual, the team, the employees cannot feel the impact of their HR manager. If that is the case, then that is already quite a challenge for the organization and for the employees and their mental health. So it is important that you manage relationships, you balance. Yes, that's the word I'm looking for. You have to create balance. There will be times when people are asking for more time off. You have to find a way to be more flexible about work time. You have to find a way to be more flexible. This might be a good time to revisit the performance indicators, all the measures that you had agreed on at the beginning of the year. If you haven't revisited them, and people have worked from home for, 3 months, depending on the organization, people have worked from home for all this period. If you haven't been able to have the necessary conversations and put things into perspective for your employees, it's going to be very, very difficult for you to rebuild the organizational culture, to reinvigorate organizational culture. You want to put confidence back in the employees and tell them you can still be excessively productive, you can still give everything that you can. We are here, we will support you. You have to be able to do that. So building a culture of connection, building a culture of connectivity, how can you access, how do employees access you? How can you access them? Are you reachable? Is there a system? Do you have like a CUG system where everybody's paid for and they can, if there's an emergency, they can actually reach you? These are the cultures that we need to put into place in the workplace right now, post-COVID and going into the future. The entire rest of our lives is post-COVID. The effect of COVID-19, probably the full effects, may not be felt in the next 3 years. So this is something that we have to build into our organizations going forward. Communicate. So it is important that you communicate clearly, concisely, and early. Many times, a manager is given an instruction about a change. So change management is key for now, because organizations, so the entire world is in a state of flux. So if you can't manage change properly, then it's going to be a huge challenge, because you might not be able to communicate correctly. Communication is two-way, so you might be saying the right things, but you're not saying them at the right time, in the right situations, and to the person in the right frame of mind. So all those factors now need to come into organizational communication. Pardon me. Organizational communication. So if you used to send those emails that are just start emails, 1, 2, 3, warm regards, see you, you need to, come back and maybe start all your mails with, I hope your day is going well. It doesn't cost you too much. And, just that connection in the communication within the organization would help a lot. Are we investing in preventive mental health interventions? So people ask, oh, EAP, really? EAP, isn't that a foreign concept? What's an employee assistance program? With an EAP, you will be able to identify at-risk employees so that you can have a backup plan. So there are people whose stress levels are already really high, and so they need to be managed. Maybe they need to be moved where they sit. Maybe you need to change how they come to work. Whatever you need to do as HR, this is a good time to modify policies and procedures, to look at what exists and look at what you need to put in place now, and to let employees know that you have considered what they are going through. So I want to talk at this time about connection between the managers and their employees. It's practically, it's difficult because it's like you live in a bubble. So it's difficult to connect. You might have that disconnect between what is happening with your employees, how they come to work, where they live, how much power they have access to, whether they have pipe-borne water in their houses or not. Those practical factors, stress factors, you might actually be isolated from them, and that might prevent you from understanding. So an EAP gives you that middle ground to have conversations which you wouldn't normally have, in the workplace. And then comprehensive medical insurance. Now more than ever, it is important that organizations think about the health, the robust health, all-round health of their employees. I know organizations who take out mental health so that they can, reduce their subscriptions for their insurance. Stop it. HR, think about it. Think about your employees. So we need to manage mental health in the workplace. We need to be serious about what we are doing. We need to consider the employee. We need to increase productivity for the organization. We need to secure the organization such that the organization can meet her goals. And we cannot do this if we don't consider the mental health of every single employee in your organizations. Thank you very much. I hope that this was interesting. Thank you.
Thank you so much, Aitaya. That was brilliant. Thank you so much. And I loved quite a bit of what you said within your session. Investing, you said how organizations should take investing in future, mental problems that could come up in the organization seriously. I also loved what you wrote about communication. Sometimes we could be very brisk in our communications. This was something I also had to learn over time as I grew in my role. You need to, when people read from you, they need to see a bit of your heart before you get into the subject matter. And it doesn't take anything from us. Thank you so much. We don't have so much time, so we'll just take one question. If you look into the chat box, people are really screaming there, saying thank you. I think people really loved what you said. We actually have 2 questions, but we can only take one. So I'll take the one that I think is most critical here. And what this person said, Cynthia asked, what are your thoughts and how would you advise HR when approaching management to get their buy-in for EAPs? in the face of the COVID-19 induced drop in revenue. So like this will not, typically, I mean, I'm a HR professional, so this will not be really high in the high up in the list of the CEO's, you know, top agenda. So I mean, that's what this person is trying to ask there. So how do we do this sort of justification?
I think I would answer. I would personally look in terms of how much more revenues can drop if the EAP is not put in place. So people have suffered 1, 2, 3, 4, 5, 6. We've had what, 20% drop. If we put this in place, we can nip it at 22 or 25%. If we don't put it in place, people will suffer more, and we might be going at 40% in 6 months' time. So you have to do the numbers. You have to do the numbers. You have to do. You have to have data. And we've had, you know, I mean, we've had, I think, Toby talk to us about data today, the importance of data. So have the conversation with data. I think that's all that will win now. And you can build in some of, WHO is doing some amazing work, putting some data up there. So you can go in there and extrapolate, you know, and extend. So organizations like ours, this is what they have found. So organizations like ours, this is what they have experienced. Organizations like ours, this is the kind of EAP. Most times when people talk about EAP, again, they're not able to focus on which aspect. So employee assistance programs is a wide spectrum. It's actually a wide spectrum. So to be able to deal with it, to deal with management, you probably need to be able to pick out the pertinent factors so that your EAP can be practical at first, and then as you grow, you can add other factors. You might want to start with just opening up a counseling office. That is part of an employee assistance program.
Well, thank you so much. Thank you so much. We have time. We were supposed to stop a minute, just a minute. So we can take the second question. The second question goes forth. How do you manage the mental health of your workforce when they are disillusioned by poor leadership and inadequate policies?
Oh, wow. And you are HR.
Yes.
I think you have to stand in the gap.
A lot of people work in toxic environments right now.
Yes,
I mean, from what I have gathered.
Yeah, and part of what I was saying, the examples I was using were real examples. Managers that cannot be approached, managers who have refused to stay up to date. There's no easy way to answer that. I think it would be important to know the peculiarity of the organization, because there's always a low-hanging fruit. There's always something that you can use as an entry point for the conversation, for the right conversation. And sometimes HR is able to engage at a higher level for the betterment of the organization. So it's a conversation that needs to be articulated based on organization, based on the peculiar situation. So it will be difficult to give like a blanket rule now, because, toxicity itself is on a spectrum.
Yes. It ranges. I mean, the range will be different depending on the organization, just like you said. Thank you so much, Aitayo. Thank you so much. We had a fantastic time today. Thank you for your session. It was brilliant. We're all so excited to have you. Thank you for answering our call when we reached out to you. We're so grateful. On behalf of everyone, we say thank you very much. On this note, I will now